Nerving news from China. A government team says there are now more than 200 cases of a new virus, a new strain of this virus, and it's possible it could spread more quickly and widely. Analysts say human-to-human transmission of this strain of the coronavirus is confirmed. The spread of the viral pneumonia comes as China enters its busiest travel period. The outbreak may have started late last month when people picked it up at a fresh food market in Wuhan, that is a city in central China. 3 U.S. airports started screening airline passengers coming from central China.
CBS 4 News Health Alert. Human-to-human transmission of a dangerous virus is spreading in China, and that has U.S. officials worried it might come here. China has more than 200 confirmed cases of coronavirus, which produces pneumonia-like symptoms. 3 people have died from the illness, which has spread to at least 3 other Asian countries. At 3 airports across the United States, the CDC is on guard. More than 100 officials in San Francisco, Los Angeles, and New York are screening incoming passengers from Wuhan, China, to detect the deadly coronavirus.
If it's issues that are going to affect others, it's maybe good choices to be cautious about it.
Since Friday, the number of known infections in Asia has more than quadrupled. Cases confirmed in China, Thailand, Japan, and now South Korea, which reported its first case this morning. Authorities say most of the cases link back to a now shuttered animal and seafood market in Wuhan. Chinese nationals are also expected to make an estimated 3 billion trips starting this weekend through mid-February to celebrate their annual Lunar New Year, which could make the virus harder to contain. U.S. health officials are concerned the rapid spread could mimic the massive SARS outbreak in the early 2000s, which resulted in 774 deaths in 29 countries. But so far, it does not appear that this disease is easily transmittable between people. Health officials say this strain of the coronavirus has been spread to humans through exposure and handling of animals at the Wuhan market.
If the virus turns out to be readily transmissible from human to human, then we'll have a much larger problem on our hands.
Dr. William Schaffner says public health authorities are already working on ways to fend off the epidemic.
There are laboratories around the world already working on really good diagnostic tests, and we've already started to work on a vaccine in the event that's necessary.
As we reported, South Korea just confirmed its first case of the virus. Meanwhile, the National Health Commission team says 2 people in southern China caught the disease from family members.
Scanners at the train station in Beijing as authorities screen passengers for the coronavirus. Many in the city say they'll wear face masks as a precaution.
I think it should be okay as long as we take personal protection measures. I always bring disposable masks when I go on the subway or crowded places.
Right now they're saying that the cases in Beijing came from Wuhan and then they fell ill, not that Beijing itself is the source of the epidemic. So I don't think it's too serious.
The hospital where the virus first appeared has treated over 60 patients with pneumonia-like symptoms. Chinese authorities say they have the situation under control.
What I can tell you is the Wuhan local government is currently taking measures with outbound travelers.
According to state media, Chinese President Xi Jinping said the recent outbreak must be taken seriously and that party committees, governments, and relevant departments at all levels should put people's lives and health first. The first victims are said to have been infected at this Wuhan fish market, which has since been disinfected. But authorities are fighting a difficult battle. The virus has spread to the north and south of the country, with 139 new cases reported in Beijing and Shenzhen. That takes the total number of people infected over 200, a significant jump from the 62 reported just days ago. The viral outbreak is reminiscent of the 2003 SARS epidemic that killed nearly 800 people and infected over 8,000. And now the virus has spread internationally. So far, cases have been reported in Thailand, Japan, and South Korea. Just a few days before the mass migration starts for the Chinese New Year, those traveling are advised to stay away from animals and sick people and not to eat undercooked meats.
New virus that has infected more than 200 people in China can be spread through human-to-human transmission, experts revealed today. The new coronavirus comes from the same family as SARS, which killed nearly 800 people, including 44 in Canada from 2002 to 2003. The virus originated in the city of Wuhan, but there have been cases reported in Beijing in Guangdong province. And there are real fears the outbreak could spread to other countries during the busy travel season for the Lunar New Year. The Public Health Agency of Canada just moments ago finished a briefing on the situation. It says the overall risk of the disease spreading to Canada is considered at this time low, but the agency will be implementing measures, including warning signs at major airports this week. So is Canada doing enough to prepare for the possible spread of this virus? Joining me now from Toronto is Tony Clement. He was Ontario's health minister during the SARS outbreak. Hi, Mr. Clement. Nice to see you. Thanks for making time for us.
No problem.
I want to be clear off the bat here that the risk to Canada, as we said, from the Public Health Agency is currently assessed at low for this new strain of coronavirus. However, it has been identified in 4 countries, and China confirmed that there has been human-to-human transmission. You have been there before in your capacity as Ontario Health Minister during SARS. From your experience, can you sort of shed some light on what might be happening behind the scenes right now?
Well, here's a couple of the problems that we have to face head on. First is that Chinese authorities were not very forthcoming during the SARS outbreak when and where things were happening. And so we were behind the 8 ball in responding to things. So if that's still the case here, that's never a good sign. Secondly, the problem with some of these diseases is that when you contract the disease, you may not have symptoms for several days. With SARS, it was a 10-day incubation period. So you might be able to pass through an airport screening process, not display any symptoms, and then come down with the virus a few days later. So airport screening sometimes is ineffective. In this case, we do have a better pandemic plan than we did back in 2003 when SARS hit, and certainly our hospitals should be notified. There should be enough antiviral medicine like Tamiflu available, and the pandemic plan should be activated in an abundance of caution. Vashi, you're right. The risk right now appears to be low, but you should always hope for the best and plan for the worst.
Let me circle back to something you mentioned off the top there, and that was that Chinese authorities in the past have not exactly been very forthcoming. How do you as a government sort of address that fact? How is there any way to find out, for example, if they are being forthcoming enough, or are there mechanisms in place? I know the WHO is meeting, the World Health Organization on Wednesday. They're convening an emergency meeting. Like, are there mechanisms to figure out whether or not that's the case?
Yes, I think you've hit the nail on the head. The World Health Organization does have to get involved. They have to get pandemic health experts on the ground in the affected province of China to see what is going on, away from the city centers perhaps, and certainly in the city centers. So there are things that can be done. Public health experts can be in the field, and that's what you need to have happen almost immediately.
Developments out of China on a new illness. Officials there have just confirmed the first human-to-human transmission of coronavirus. It's a huge story. The number of people infected with the new virus tripled over the weekend. Arthi Pole is working on this. What are the details, Arthi?
So what we're hearing this hour is, in fact, that officials within China are, as you stated, they are confirming that there has been human-to-human transmission of this virus, specifically in a province in southern China, that a relative there, media, is reporting that a family member contracted the disease and it was transmitted human-to-human, also saying that some medical workers have tested positive to coronavirus, a respiratory illness. And essentially what makes this a huge development is that it makes it more difficult to contain the spread when human-to-human transmission is a factor here. Now, we do know that essentially this was an outbreak that started late last year. It initially was believed that it was contracted at a food market, at a meat market, seafood market rather, and that was in Wuhan province, and that's in central China. And now we're learning that it spread to southern China. But that's not it, because also the numbers are important to look at. If we can quickly pull up what the latest numbers are in terms of cases and number of people who've been killed. More than 135 new cases were confirmed in China
just over the weekend. 3 deaths have now been confirmed, and that makes a total of more than 200 people who have been infected with this coronavirus. There have also been some cases confirmed in South Korea, Thailand, and Japan as well. Now, a lot of health officials raising alarms in particular around this virus because it's from the same family as SARS. And you'll remember that back in 2002, 2003, roughly 800 people were killed globally due to that specific respiratory virus. Now, in terms of containment in China, there are some fears right now because it's the Lunar New Year. There are going to be hundreds of millions of people traveling domestically. And that is why there are, in fact, new measures taking place on aircraft and at airports. And we do have some video to share with you that was tweeted out by a reporter who works for a local news agency in China, unconfirmed by CBC News. But you can see in this video that there are healthcare workers here who are, it appears, taking the temperature of some of the passengers. And this is just one of the measures that they are taking right now in order to try and prevent the spread of this coronavirus. Again, though, we're looking at more than 200 people already infected. Suhana.
And what precautions has Canada put in place, Arthi?
Well, it's interesting because we've heard from the public health agency here at home, in fact, that they say that they believe there's going to be a limited risk here for it to be spread. But they are also implementing new measures at some of the major airports within Canada, saying that there will be screening questions at kiosks. There will be messaging on screens also at arrival gates. Those are just some of the measures that will be taken by specifically the airports here, by border control. And also, we want to just share with some of our viewers some of the other travel advisories that exist right now, and that is that travelers should avoid high-risk areas such as farms, live animal markets. In addition to that, they are also saying that people should be precautious when it comes to contact with animals like pigs, chickens, ducks, and wild birds. And finally, one more precaution that is being highlighted right now, and that is avoid surfaces with animal droppings. Again, though, there is now this risk of human-to-human transmission that was confirmed by officials. Suhana.
All right, you'll watch for further numbers and reaction. Thank you, Arthi.
You're welcome.
China was criticized for initially covering up the deadly SARS epidemic in the early 2000s. So are they better equipped this time around, given their experience in dealing with such a health crisis of global consequence?
Well, SARS was definitely a painful lesson for China, originating in the country. And then after that, we saw about 800 people die because of SARS worldwide. And so technically, China should be better equipped to handle this latest coronavirus outbreak. And yes, we have seen that China has beefed up its infectious disease control system as well as its reporting system. Wuhan authorities are also saying that they have set up a prevention and control command to direct efforts to control the spread of the virus. We have also seen top leadership weigh in on the situation. Chinese President Xi Jinping calling for resolute efforts to curb the spread of the epidemic. And also we see the World Health Organization involved in this. And so all these are positive things, but there are still definitely some concerns. And if we were to look at some of the editorials that have been published by Chinese media, there's one key message, and that is a need for the public to be kept fully informed so as not to repeat what had happened during the SARS outbreak. Now, the China Daily in an editorial said that while medical workers did a good job in identifying the new coronavirus, they said that perhaps that Wuhan authorities had been too hasty in saying that there was no human-to-human transmission, or that was unlikely, because if you recall, first authorities did say that human-to-human transmission was unlikely. Last week they said that they could not rule out the possibility of limited human-to-human transmission. But yesterday it was confirmed that human-to-human transmission had already taken place, with people being infected when they had not visited Wuhan. And also we've seen medical workers being infected as well. Now, another criticism had been that some of the statements made by authorities, the editorial said, that did not offer much reassurance, given the fact that the SARS virus, when it first infected humans, later morphed to become more virulent. And so the statements that are being made right now currently don't provide much reassurance, or don't provide enough reassurance rather to the Chinese people. And so there are calls for there to be more urgent and effective quarantine measures and to address the spread of this virus.
Yeah, speaking of the spread, Olivia, the virus has now hit 3 cities across China, and with news of medical workers being infected as well. I mean, is there a sense of public anxiety over the epidemic?
Well, anxiety levels have definitely risen since yesterday, as we've heard. The number of cases spiked dramatically overnight and over the weekend. And so on Weibo, which is a Chinese social media platform, the coronavirus spread and other news related to it has been trending since yesterday and continues today as well. And another key reason for the anxiety and concern is that this is not such a good time for this epidemic to be taking place. This given that the Chinese New Year break is coming up later this week, and already we are seeing a huge travel rush as millions of Chinese travel across the country to get